Hi, welcome everyone. This is Dr. Ben Pandit. Um, we are going to be talking about the skeletal system. Welcome. This is Bio 201. Okay. Without further ado, let's get to it. So, so skeletal system now, we're going to talk about the bones, right? We're going to talk about the bone. And if you remember from the previous unit that we were talking about, bone is a connective tissue. Okay, bone is a part of the connective tissue, and the key terms definitely I want you to remember is the bone is dynamic. Uh, Dynamic means that it keeps changing all the time. Okay, bone it actually it keeps changing all the time, even though it kind of stopped growing. Uh, Even though it doesn't grow anymore, but it continued to change over time. Okay, and extracellular matrix of the bone is we call that osseous tissue. Osseous tissue. Okay, um, bone actually have a calcium phosphate, which is hard mineral bone, called the hydroxy apatite. Okay, apatite, hydroxyapatite. So you have the collagen also that's in the bone. Okay, so bone usually is the one that make up the skeletal system. So we're gonna look at that more in detail. And other things of the bone, you have the tissue, the marrow, the cartilage, the periosteum. We'll cover all of that. And again, anytime you see the word function, you guarantee you will see that question on my exam. So function of bone, what does it do? It actually provides support. Most people think bone is just kind of help supporting your body, but it's does more than just support. It actually help protection as well. Protect your bone. You have bony cage right here, right? Your rib cage. It protects the all of the vital organs actually inside that rib cage. So you have your lungs, your heart, your stomach, your inner organs, diaphragm. All of those are uh, important organs in your body that your rib cage is protecting. It helps with movement, with your muscle. It actually, without bone, you won't be able to move. The key things that people tend to forget, and this is something that really people don't talk much about, bone actually makes your blood. Hematopoiesis, in making of the blood. So without bone marrow, without bone, you won't be able to actually make blood. So huge key in terms of making your blood. Bone is also storage of your calcium, phosphorus, and the fat as well. And bone also control your pH balance. So all of these are the function of bones that you do need to remember for your tests. Okay. There's two kinds of bone. There's a compact bone versus the spongy bone. Compact, as it sounds, is more dense. Okay, you could see right around here on the outside here. These are the outlining of the compact bone. All of these are compact bone. Okay, so a little more dense. Okay, whereas spongy bone, you could see there's holes everywhere. All of these are spongy bone everywhere. All of these are spongy bone. There's holes everywhere. So there's a differences between the two, and I want you to make note of that. Okay, and know this classification of bone. I will ask you this on your exam. Okay, long bone is pretty easy, right? Long bones, you anything that's long like this. So you're gonna be like your humerus, your tibia, fibula. All of these are long bones. Your ulna and radius, all of those are long bones. Okay. Then you have short bone as well. Okay. So this is based on the shape. So if you look at the previous one, this is classification based on the shape. So you have the long bones and short bones. So you should know the short bones are like your carpals, which is in your hand and tarsal, which is in your feet. Okay, so those are considered short bones. So know the example of these. Okay, know the example of these. So on the test, I might ask you which of the following is the long bone, which of the following is a short bone. So you should know the example of these terms. Okay, and again, you do have combination of long bone versus short bone here, and you can determine which one is which. Okay, and then you have another shape that you should know is called the flat bone. Okay, flat bone. So flat bone are a bone that mostly in your skull. Okay, you have many bone in your skull are flat, so that's part of your skull called cranium. Okay, your sternum, which is your right here in the middle of your chest. Okay, and between your rib cage, that's the sternum, also flat as well. The coxae, which is your coccyx bones, also flat bone as well. uh, your scapula also a flat bone as well, which is in the back here. Okay, those are considered flat bones. Okay, and the last category of the shape is basically the irregular bone. Irregular bone meaning that it's not really conforming to any one specific shape. Okay, one specific shape. It's just kind of all over the place, kind of oddly looking shape. So, and the sample of that would be like your vertebrae, okay, your spine, your vertebrae, your hyoid bone, which has two little horns on the top and two on the bottom, which is right up in here in your neck. Okay, your sacrum. Okay, this is your sacrum. The picture that is showing it is the sacrum. As you can see it, irregular bone. Look a little bit like elephant, and your coccyx, which is these bones down here. Okay, these are the coccyx, also irregular shape as well. So know the example of these. I will ask you. Okay, and these are the example of the two, the flat and the irregular bone. Okay, flat and irregular bone. So as you can see right here, you have long bone, short bone, irregular bone, and flat bone. So make sure of those. Okay. So let's talk about long bone, and for the most part, we can just focus in this chapter on the long bones. Okay. So for the features of the long bone, you have the epiphysis. Okay, epiphysis, which is kind of like the end. Okay, think of it as the tip part of your long bone. Okay, you have both ends epiphysis. And in the middle, we call diaphysis. Okay, diaphysis is in the middle. Okay, diaphysis is right in the middle. Okay, between two epiphyses. Okay, and in the epiphysis, you have the spongy bone, which is right here. Okay, location of spongy bone, and you actually have cover of the compact bone. You have compact bone that kind of covers surrounding it all around the place. Okay, it has a red bone marrow. This is something you must know. Okay, so the epiphysis has the red bone marrow, and your red bone marrow is the one that produce your red and white blood cells and your platelets, so your blood in the red bone marrow. Okay, and diaphysis is the shaft. Okay, it has also a yellow bone marrow. Okay, yellow bone marrow, and mainly the yellow bone marrow is fat storage. Okay, this is where we store fat. Okay, in the inner lining of that, in the inner lining, which is along here, in the lining we call the endosteum. Okay, endosteum, which is the inner lining of that, and then the outside lining we call it periosteum. Periosteum. Periosteum is the layer that covering on the outside of all of the bone. Okay, and in the endosteum, you actually have what we call the osteogenic cell. Osteogenic cell is the cell that produce more bone cells. Okay, this is like the origin of the bone cells. Okay, origin of the bone cell. This is where your bone cell begins. Okay. As you can see right here, again, spongy bone, compact bone, which is on the outside. The red bone marrow are in the epiphysis, okay, on both ends, and then you have uh, the yellow bone marrow in a diaphysis. Okay. Continue on the feature of your long bone. Your long bone also have the cartilage, articular cartilage cover at the end. Okay, and at your epiphysis right here. Okay, you oftentimes have the cartilage that kind of covers it. Okay, and you have the something called periosteum, as I mentioned. Periosteum is the outside layer that kind of covering all around the bone, just kind of giving that the outside protection layer. Okay, and periosteum also you have these what we call the epiphyseal plate or epiphyseal line. Epiphyseal plate, which is right here. This is the picture of a young person. Okay, when you are young, you have these epiphyseal plate. Okay, epiphyseal plate, meaning that this plate it tends to grow, and then help your bone actually grows. Okay, help your bone actually grows. Epiphyseal line, when you actually become adult, when that times come, your bone actually stop growing. You're no longer gonna grow anymore. So when you're no longer growing anymore, this line, this plate, become a line, epiphyseal line. Okay, so keep that in mind. So the line refers to the adult, and then the plate go referring when you were a kid. So that means you're still gonna have more growth. Some people actually, when they're younger, when they each long bone has all of these, including your fingers, are long bones. Let's say you injure your finger and you actually break your epiphyseal plate. So that finger will be shorter than that bone will be shorter than the rest because they cannot grow anymore. So it become from the plate to a line. Okay. So this is just a little diagram showing you the all of these. You have the proximal, which is closer to your body, proximal epiphysis, and then distal epiphysis, and you have diaphysis right in the middle. You have the medullary cavity, which is the cavity in the middle where the yellow bone marrow actually stays in. You have the periosteum, which is again the covering on the outside. You have the epiphyseal line for the adult, and then epiphyseal plate for the kids. You have the articular cartilage. This is where it's articulating with other uh, joint. We'll talk about joint later on. You have the spongy bone right here. You have the compact bone. Okay. Um, you have the endosteum, which is the inner layer here. Okay. Periosteum on the outside, which just has blood vessels and other things that kind of help the bone nourish the bone. Okay. You have perforating fiber, the nutrient arteries that goes in. Okay. And if so, you're gonna be putting labeling these just based on those pictures. You're gonna be using this word and then label or put letter in front of these words. Okay, so you're aware of what which one is which. Okay, you could figure that out. So next one is the feature of the flat bone. We talked about the feature of the long bones already. So now we're going to focus on the flat bone. And again, flat bone is in your skull, right? Mainly in your skull. You have your sternum. That's your flat bone, and a couple more places that flat bone. So so most the internal surface of your flat bones are composed of the compact bones. Okay, composed. Think of this like a sandwich. Think of it like you have like a hamburger or sandwich where you have the white bread on the top and the white bread on the bottom, and then you have your burger of meat in the middle. And that's the same thing what the flat bone is like. You have the compact bone on the top, compact bone on the bottom, and you have a spongy goodness in the middle. Okay, and this spongy bone is in the middle right here. Okay, and the key thing is there's no marrow cavity, meaning that there's not a lot of bone marrow in your flat bone at all. You cannot find your bone marrow in there. Okay, now we're gonna shift gear and we're gonna go into the type of your osseous tissue. Okay, your cells of your osseous tissue. The cell of the osseous tissue actually composed of three main cells. Right here is the three main cells. First one is the osteogenic cell. Osteogenic cell is, just think of osteogenic is your beginning, your genesis at the beginning. This is your beginning cell. Okay, this cell will eventually form the osteoblast, and then osteoblast, think of osteoblast, b blast for building, and this is like a baby cells. Think of like a brand new cell, baby cells, and then osteocyte is your adult bone cell. Okay, so osteogenic is usually in the endosteum, which is the inner layer. Okay, sometimes it's in the periosteum as well, or central canal. All of these locations, this is where osteogenics are. Okay, and they continue to keep multiplying. So these guys like to multiply. Okay, split themselves using mitosis, splitting themselves more and more of themselves. Okay, and then it differentiate into non-dividing osteoblasts, meaning that it changed from this guy into the osteoblast, and osteoblast will no longer split, no longer go through mitosis. Okay, it will stay. Think of like a baby cells. Osteoblast, a brand new cell, brand new bone cell, baby bone cells. Okay, osteoblasts form and help mineralize organic matter of matrix. Okay, and we're gonna talk more about that later on. Osteocyte then become trapped and then form it. Once they become trapped in the matrix, then they form bones. Okay, part of your bone cells, and they usually in the lacunae. Okay, lacunae, which is a little gap, like a little cave for osteocyte. Okay, cave for osteocytes, and then you have canaliculi. Canaliculi. These are little gap junction that connects between one lacunae to another lacunae. Okay. And then you have a signal osteoclast. Osteoclast is the fourth character, fourth player here. Okay. Osteoclast is instead of blast B for building or brand new, and class is catastrophe or catastrophic. Think of breaking it down. So osteoclast will break down the osteocytes. Okay, so think of it that way. So as you can see, these are the osteoblast. Okay, and then they become osteocyte in the bone matrix. Okay, you could see this inside the lacuna, and this is part. All of these you should be familiar because it's um, part of your practical one. So you have the osteocyte, osteoblast in the middle, osteocyte in the middle. Okay, where you have all of these. Okay, lacunae and osteocytes. Okay, everywhere. And then you have osteoclast. Osteoclast is breaking down of your bone cells. Okay, breaking down of your bone cells. Okay, so osteoclasts develop in the bone marrow, and these guys will actually have these what we call the reabsorption base. Okay, reabsorption base, where they will start breaking down. Okay, breaking down the surface of the bone, and actually has these lysozyme. Uh, this is the digestive enzyme that actually start breaking down the bone, and then you're gonna see the bone kind of goes away. Okay, what the key things for osteoclast does, okay, is that it releases minerals from your bone. It actually breaks down your bone, but what it does is it release your calcium, your phosphate, your magnesium that actually in your bone when your body needs them. Okay, when your body needs them, it breaks down your bone so that you could actually use some of the calcium, some of the phosphate, some of the magnesium in your bone if you don't have enough. So think of them like bone eaters, so they are breaking down your bones. So know what they do. Okay, know what they do. You should be able to describe the sequence of osteocyte, which one comes first. Okay, uh, so put these in correct order. Okay, A, B, C. Put them in correct order. And the same thing with this. This is the osteoclast formation. Putting them in the correct order. Okay. So next topic would be the bone cells. You have different bone cells. You have, again, you have osteogenics, osteoblast, osteocyte, and osteoclast. Okay, now we're going to talk about the extracellular matrix of osseous tissue. Okay, extracellular matrix of osseous tissue. So you have different component uh, that compose of these organic matter. You have one third of it is organic, and then two third of it is inorganic. Okay, the organic matter would be like your collagen. Okay, your glycosaminoglycan. Okay, glycosaminoglycan. So you actually have three different things. You have the glycogen, your amino, which is your protein, and then your glycan, which is part of your fibers. Okay, and you have proteoglycans and then glycoproteins. That's all of these are organic matters. Okay, you have also inorganic matters. 85% is hydroxyapatite, right? Uh, that's the crystallized calcium phosphate. And then you have 10%, which is the calcium carbonate. That's 10% of your osseous tissue. Okay, and then you have combination of your organic and inorganic matter. This actually helps strengthen and make your bone more resilient. Okay, make your bone more resilient, and this has been shown through several studies. Show that if you actually have your bone, let's say if your bone is actually a solid piece of wood, just pretend that your bone is just a solid piece of wood. That piece of wood actually doesn't stand a chance in terms of pressure. If you apply enough pressure, it can be easily break. But what happened if we kind of make the inside kind of hollow and you actually have this mixture of different like the the organic versus an inorganic matter, make it like the mixture of between both. It actually helps strengthen your bone. That makes your bone actually can withstand a much higher pressure. That your bone prevent your bone from breaking easily. Okay. So as you can see here, with okay, this is your normal bone without minerals. We remove your minerals, your bone become very flexible. Okay, very flexible, pliable. But without the collagen, without the organic matter stuff, your bone become brittle, really brittle. So your bone just have the right ingredient, just kind of just a perfect ingredient to make it nice and strong. Okay. And we're going to look at the compact bone, structure of the compact bone now. Looking at the differences between the compact bone, okay, compact bone versus the spongy bone, right? You have compact versus spongy bone. And some of these terms you should be familiar already because we cover it in the lab already. Okay, so first one is called the osteon. Osteon is the basic structural unit of the bone. Again, osteon, you have the central canal and you have the concentrating uh, lamella covered as an osteon. Okay, as an osteon, as one unit, basic unit of the bone, of the compact bone, right? You have lamellae. Okay, lamellae is the layers. You have the concentric lamellae, which is these layers right here. Okay, and you have the central canal where the blood vessels goes through. Okay, and you have osteocytes that actually live along this lacunae. Okay, you have these osteocytes in the lacunae that's in on the lamellae. Okay, everywhere. Okay, so that's the osteocyte. And then you have the little canal that connecting between the lamellae, we call the canaliculi. These are canaliculi, okay, that connecting from one lamellae to another. Okay. And then you have the perforating canal or Volkmann canal, which is we'll see a little bit bigger, where it just forms a transverse cross section of it, where it's connecting one central canal to another central canal. Okay, look just like this. Okay, again, you have the part of the compact bone. You have lamellae, concentric. Uh, Concentric lamellae. You have the interstitial lamellae between the osteon. Okay, you have the osteocytes, which is in the lacunae, right? You have the periosteum, which is on the outside. You have the perforating canal. You have central canal here. You have the spongy bone here. Okay, so that should be very familiar to you, hopefully, because you've been studying these terms quite some time. So small line canaliculi, the cavity is central canal. The concentrating circle, that's the lamellae. Small cavities are lacunae, and is osteocyte that's inside it. Okay. See, and same thing. And now let's talk about the spongy bone. Spongy bone. Spongy bone. Basically, you have the structure, these little holes, these tons of pores like structure is called trabeculae. Okay, trabeculae. These are the whole bunch of pores right in the middle. Okay, filled with the red bone marrow. So these are have tons of red bone marrow. Okay. Trabeculae, very few central canal or few osteon inside it. Mostly just kind of empty holes. Okay, and there's no osteocyte whatsoever because there's not a lot of blood vessels in the spongy bone area. Okay, this provide the absorption, like if you have any type of impact or high pressure, these spongy bone can actually absorb some of those pressure and some of the weight that you're putting on your body. Okay. And you could see these are the stress line. If you actually put pressure on top of the spongy bone, enough pressure, it can break, and usually break along these lines. Okay, these we call it a stress line. Okay. Um, okay. So the red bone marrow, usually uh, you could see these in the red. These are considered where you have the red bone marrows. Okay, your red bone marrow are here. This is where the key things I want you to remember is right here. This This is where you produce your blood cells, your red blood cells, your white blood cells, your platelets all come from your red bone marrow. Okay, and your red marrow it usually in your trabeculae. Okay, your trabeculae in those spongy bone part. Okay, and they have a whole bunch of immature cells, reticular fiber in that red bone marrow. But again, key things is this and this. Okay, things that you want to remember for your test. Where can we find the red bone marrow? It's your vertebrae. You can see these are your vertebrae. Sorry, a little off. These are your vertebrae. Okay, and then you have your ribs, your sternum. Your ribs are here. Your sternum right here. Your pelvic girdle right here. Okay, and your proximal head of femurs and humerus in the adult right here. These are good sources of you making your blood, places where you actually make your blood. You also have the yellow marrow. Usually, yellow marrow are in the medullary cavity, and this is in the yellow part of the bone. Okay, all these yellow bone have the yellow marrow here. Okay, part of your diaphysis, as we mentioned before. You also have the gelatinous marrow, and this is basically the yellow bone marrow. But when we get older, okay, it become the reddish jelly, oozing, yucky color. So um, we call it gelatinous marrow. Okay, if you ever do any type of cutting, bone cutting with the adult, like really older folks, you're gonna see this gelatinous marrow. Okay, and this is show how your minerals are being deposited onto into your bone. You have this mineralization, basically how your minerals are being deposited. The first process is called the crystallization. Okay, crystallization. This is where your calcium, your phosphate, your bicarbonate, and other minerals are taking out from your plasma, from your blood, and then being deposited into your bone. Okay. So, first thing that it does, okay, you have these collagen fibers, as you can see right here. Okay. You have these collagen fibers start to actually, you have collagen fiber spiral along with the length of the osteon. Okay. You have collagen fiber spindle like right here, wrapping around the osteon. Okay. um, and then these fiber then kind of trap those minerals, and because of the osteoblast is the one that kind of cause it to be a little sticky, and then those minerals kind of trap those um, blood cells and those minerals in your blood that being pulled out. Okay, and then those starting to form uh, into the uh, into part of your bone. Okay, this is a disease called myositis ossificans, where you actually have a bone formation growing in the wrong place and the wrong time. Uh, Instead of your bone formations growing in the middle, these folks actually have their bone formation growing on the outside of the bone. Okay, on the outside, and even sometimes parts of their muscles actually will have all of these are your bone formations. Okay, uh, part of the muscle actually start having bone growth in it, and that makes it difficult for them to move around. Okay, really makes them difficult to move. So this is the opposite process. This is called the mineral reabsorption. Mainly, instead of depositing the minerals into your bone, now we're gonna remove the minerals from your bone. Okay, and the way we do that again is we use the osteoclast. Okay, osteoclast has these ruffled borders. Okay, ruffled borders are these right here. These are ruffle borders. So uh, okay, and um, they pump, they trap, they trap the hydrogen. Okay, they secrete these hydrogen ions. Hydrogen ion are highly acidic. Okay, highly acidic. So when you actually put a lot of hydrogen ion into the space right here between your bone, okay, this is they trap this little space here. Putting this space into your bone and the osteoclast, these hydrogen ions will start breaking down the bone. Okay, it will start breaking down the bone. As it breaks down the bone, it actually being released. Okay, as you can see, being released the minerals going off on the top of the bone. Okay, going on the top of the bone. Okay, so keep that in mind. And the pH of this is pH of 4. Basically, it's acidic. Okay, pH of 4 is acidic. And they release these minerals back into your blood. And again, like as I mentioned in the very first part, is that your bone is dynamic. It changes all the time, right? It keeps changing throughout your whole life. Sometimes you need it's like you, if you have tons of minerals that you don't need, you start putting those minerals into your bone, and when you start needing it, you start kind of shipping your bone away to kind of use some of those minerals again, and this is the process of doing that. Okay. And there's two hormones that actually mainly control all of these. Okay, control your minerals, breaking down your minerals, and or deposit your minerals. And first one is called calcitriol. Okay, calcitriol. This is basically this is a vitamin D. It's activated vitamin D. Plainly, it's activated vitamin D. Basically, if you're getting sun using your UV radiation, you're getting enough sunlight into your skin, you will actually uh, start processing vitamin D in your liver and your kidney, and then one of the byproduct of that is called calcitriol. Okay, and this is a hormone. This hormone tells your intestine, okay, to absorb more calcium. Okay, your phosphate and magnesium. Okay, so we'll tell your intestine to absorb more calcium, more phosphate, and magnesium into your from your food that you actually eat. Without this hormone, you're gonna have harder time absorbing the calcium that you need. Even though you have calcium in the food, but if you don't have this hormone, you don't have the vitamin D that breaks it down to calcitriol, you won't be able to absorb that calcium or magnesium or phosphate into your body. Okay. And if you don't have enough, okay, if you don't have enough, um, this calcitriol as well, it will promote the osteoclast activity to actually increase your blood calcium concentration. Okay. Um, so if you don't have enough calcium in your body, these kind of will start breaking down your bone so that your bone release more calcium in your blood, and that you could actually use those calcium as well. The two other hormones that you actually produce by yourself, this one is called calcitonin. Okay, calcitonin, basically, when your calcium, this is your bone, right? Let's say this is your bone, long bone, and this is your blood. Okay, calcitonin is actually being released by your parathyroid, actually your thyroid gland. Okay, this is being released by your thyroid gland. The way to remember is calcitonin, calcium into the bone. Okay, calcium into the bone. So it's pulling out calcium from your blood and put it into your bone. Okay, or calcium from your blood putting in your bone. So the way to remember it again, calcitonin, calcium into the bone. Okay, calcium into the bone. So if you have tons of calcium here, let's just put calcium. So you have tons of calcium here. Your thyroid gland will release this hormone, calcitonin, and then what calcitonin will do is will tell your body to actually put calcium into your bone. You're going to reduce the osteoclast because you're not going to break your bone. You're going to put more calcium into your bone. Therefore, you're going to increase your osteoblast. Okay, increase osteoblast. So think of this way: if you have too much calcium in your blood, your body, your thyroid gland will start releasing calcitonin to make calcium to put calcium into your bone. Okay. Oppositely, if you have very little, if you have uh, very little calcium in your blood, your calcium is low in your blood. Your parathyroid gland will release parathyroid hormone, okay, just like the name of the gland, parathyroid hormone, and that what it does is the opposite, is putting your calcium back into your blood. Okay, put calcium back into your blood. So it's stimulating osteoclast, okay, and is inhibiting collagen synthesis and inhibiting osteoblast. Okay, and promote calcium reabsorption. Mainly, like we don't want to get rid of calcium, we don't want to pee it out. Now we're gonna keep it in your blood because your calcium in your blood is low. So your body trying to compensate by keeping everything they can. Putting calcium, breaking your bones so that your calcium level go back to normal in your blood. Okay, this is only happen when your calcium level is low. Then you have your parathyroid hormone being released, therefore breaking your bone, putting more calcium into your blood. Okay, so so know these. This is a little simple exercise that you can do. Which one is which one promote osteoblast, which one promotes deactivated osteoclast, promote osteoclast, deactivate osteoblast. So make sure you check this out. Okay. Next big concept to remember is called the intramembranous ossification. Ossification is basically how we make your bone, how your bone were made. When you're a little fetus, when you're a little critter inside the womb, this is how the bone were formed. There are actually two main ways that how your bones are formed. Uh, the first one is called the intramembranous ossification. Okay, the first one is called the intramembranous ossification. And you have these different steps that you go through. One is called the mesenchymal, condensed into sheet of soft tissue. Okay, and then osteoblasts then gather on the trabeculae to form osteoid tissue. Then calcium phosphate is deposited in the matrix, transforming osteoblasts to osteocytes, and osteoclasts then remodels center to contain marrow spaces, and osteoblasts remodel the surface to form a compact bone. And then mesenchyme at the surface give the rise to periosteum. Okay, so this is kind of show different steps of how the membrane actually form. And uh, let's put this uh, in a little picture. And this is the second type called the endochondral ossification. Okay, endochondral ossifications. Okay, so again, this is a different modeling type, modeling uh, in terms of forming the bone. Two different type of forming the bone. Okay, you have the endochondral ossification. This is basically we form all the cartilage of your model, whereas this one is mainly your flat bone. Okay, your flat bone, your skull, your clavicle. This is the intramembranous ossification. So something you should know for your tests. Okay, that intramembranous is flat bone, skull, and clavicle, whereas the endochondral ossification is usually uh, the rest of your bone, majority of your bone, long bone as well. Okay, and you have the primary ossification center form in the cartilage model. Um, in the middle of that, you have the chondrocyte in the center, swell to form the primary ossification center, and then the matrix reduce and model become weak at the point, and then so the perichondrium produce it on a bony collar, cut off the diffusion nutrient, and hasten those cells actually dies off. The primary marrow space then form. You then have the osteogenic cells going in to which transform itself into osteoblasts, and osteo tissue deposit in the calcified into the trabeculae, and then osteoclasts work to enlarge the marrow cavity. Okay, so this is the picture of the endochondral ossification. What it looks like, you have the right here. Okay, so you have the medullary cavity start to form in the middle here. Okay, and the growth in the bone length. You have the center of bone growth would be in the tip. Okay, these are the places where the bone actually will grow. Okay, again, endochondral ossification. Okay, you have the collagenous model. So basically, it's your cartilage. You always start from the cartilage first. Okay, and then second step, you have these calcified cartilage right in the middle, and you have periosteum start to develop on the side, and then in the primary ossification center, which is right here. Okay, this is where you develop stuff in the middle because of the blood supply. As it grow, it actually cut the blood supply off by itself because of the growth of the bone forming. Once you start forming those compact bone, you're starting to cut off the growth of this blood supply, and some of those blood supplies start to be trapped right in the middle in the medullary cavity. Okay, then you also start to have the second ossification center on the outside here. Okay, on the both top and the bottom, right? The proximal epiphyseal um, and distal epiphysis. As this grow, again, you actually starting to forming the compact bone on the outside. You start forming the spongy bone because you still have blood supply going in to the middle of this, but the blood supply was got cut off in the compact bone. The compact bone no longer have those blood supply, and at the end you have these epiphyseal disc or epiphyseal plate, which is the remnant of it. Okay, and you still have blood supply into your spongy bone. You have blood supply that going into medullary cavity, but no blood supply on the compact bones. Okay, spongy bone have very few blood supply, not a whole lot comparing to the spongy bone, uh, comparing to the medullary cavity. And this is a little picture of the little baby inside the wound, and then their bone, what they look like as they're forming, as those bone are forming. In the skull, again, is the intramembranous bone forming, and then in the long bone, you have the endochondral bone forming. Okay. Next part is the growth and repair. Okay, growth and repair. Um, as your bone grow, okay, your bone actually has to be remodeled and repair themselves all the time. Okay, all the time, continuously. Stress fracture is the fracture that actually caused by trauma. Uh, these are stress fracture. We're going to talk about fractures too as well. Different type of fracture. You have the pathological fracture. Basically means that you bone something actually like stress fracture, meaning you got into a car accident, you fell, you broke your arm, or you play football, you broke your arm, your legs. Those are stress fracture. Pathological factor is you have a disease that actually causes your bone to be weakened and then breaks all the time. Usually, it takes about 2 months, 2 to 3 months to heal your bone. So 8 to 12 weeks normally. And these are the stages of your bone repair. Something you should know for your tests. Okay. You have the hematoma stage. This is where your blood supply kind of you entrap the blood the blood into that space where you actually have your bone actually broken. Okay, you're gonna form then what you call the soft callus tissue. You actually have these callus fibers, so you have some bone tissue connecting the two bones together. We call that soft callus tissue. Then the next one, okay, is the C. So you could see. Okay, so next one is called the bony callus formation. So now you have the bony callus formation start to form. So the soft callus now replaced by the hard callus in the middle. Okay, usually about 6 weeks or so. And then uh, the last step is called remodeling. Basically, just kind of shaping things in places using osteoclast, uh, making sure that it kind of go back again. If you notice, it's not back 100% like before. uh, Again, anytime you break the bone, that bone actually become more fragile in terms of breaking the next time. And over the next 6 months, your bone is still going to be reforming and uh, changing itself into a compact bone. Okay, so the same thing, same four process that we just talked about. From day one, and this is without a lot of intervention, and this is from the you could see easily this is kids, babies. Babies are amazing in terms of bone formation. They can actually fix themselves very well. You could see just in the span of 6 months completely the bone was able to correct itself into the correct position. Okay, as if nothing actually happens. Infants has that ability. So the last part of these are the different diseases of the bone. Okay, different diseases of the bone. The first one is called the Osgood-Schlatter disease. Osgood-Schlatter disease is uh, a a disease where you pull. This is part of the growth spurt. It's self-limiting, meaning it goes away by itself. But this is part of the growth spurt between the age of 9 to 16 for boys, um, and oftentimes it's boys to actually active in sport. You play a lot of sport. So what happened is your patella tendons start to pull on your tibial tuberosity. Okay, you could see this little gap here. So your patella tendon pulls your tibial tuberosity and causing a break of your tibial tuberosity. Your tibial tuberosity actually breaks off. Okay, and most often time to remember is that uh, you have a hip pain on that side. So let's say if you have a if this happened on the right knee, uh, you will actually have a right hip pain. So anytime any kids, teenagers complaining of a hip pain, the first thing you should think of is that they have maybe an injury on the knee itself. Okay, and what do we do? Basically, just rest and make sure not to play any sport or involve in any strenuous activity for the next few weeks or months. Um, Take a lot of NSAID or Tylenol to kind of help with the pain as needed. Second one is called osteoporosis. Osteoporosis is when your bone become this is when your bone become more porous. Usually is very common. This is the most common bone disease. Usually happen in women more than men. Uh, Oftentimes it's in women after menopause. And the reason for that is because of the level estrogen actually goes down. When women actually get older, your estrogen, your E2, is actually plummeting, which is going down very quickly. Opposite to men, men actually your estrogen level goes up as we age, as we become older. Men become more sensitive, so your estrogen level goes up. So when the estrogen level goes down, what that does is actually affects your bone mass. You actually losing your bone, so you losing your calcium that you are storing in the bone and causing your bone to become more brittle. Okay, you're losing both organic and mineral component of your bone. Okay, and this is why we often recommend, girls in a young age recommend to take lots of calcium. The more calcium you have um, from the past in the early age, you could actually, the less likely you actually get this disease when you're older. And the test we actually do for this called DEXA scan, DEXA. Okay, and we usually do it on your hip to see how much bone loss do you have. Okay, when you're older, we use DEXA scan to see these. Okay, most people who have osteoporosis, that means your DEXA scan is -2. You actually go below than what you're supposed to have. Okay, so if you like 0, that's not good. -1, you're getting there. That's mean your calcium level is really low, and now you start to lose some of your bone mass. And then -2, now you have osteoporosis. Okay, so it's when you do have that, it's going to be easier for your bone to break. Your bone become more brittle, easier to break. So we have to be really concerned about that. Again, risk factor: decrease in estrogen level as we get as women actually gets older. Lack of calcium or protein in the diet. You're not eating enough calcium. Lack of vitamin D. You're not getting the vitamin D or going in the sun. Lack of weight bearing exercise. Smoking also cause that as well. Again, DEXA scan. We're using that. You're gonna have like back pain, pain in your spine. You could have compression fraction where your backbone become compressed and breaks easier. Okay. Treatment, we use Fosamax. It's one of the medication that we use to kind of help put calcium back into your bone. But we definitely recommend, vitamin D, calcium, and diet and exercise. And this is easier to complete and to do when you are younger than older as well. Okay. Next one is called OA, or osteoarthritis. Okay, osteoarthritis, OA. Okay, OA. This is basically inflammation of your joint. That's what it means. Itis is inflammation. Osteo is bone. Arthro is joint. So it's inflammation of your bony joint. Okay. So you're overweight. You're getting older. You have joint pain. This is you. Most people tend to have that. Okay. You have pain, swelling, reducing your motion of your joints. Uh, many people go through these. Could be on your hand, your spine. The best thing we recommend is there's actually many type of therapy to help with these. Ultrasound does really well with different joint therapy. We also use exercise. We recommend exercise in the water. Weight bearing, like a light weight bearing exercise, is excellent as well for the people who have OA and osteoporosis. Another big, huge disease to remember, this is called rickets or osteomalacia. Rickets is in the kids, and then osteomalacia is in the adult. We don't see that here in this country because we have at least sufficient enough vitamin D. Uh, but rickets, basically, you don't have vitamin D. Okay, you don't have enough vitamin D. Um, so you need to actually get vitamin D somehow. You're not getting in your diet. Okay, and some people spend too much time indoors. Some people have celiac disease, so they have problem absorbing certain nutrients into the body. Um, the key features of these, you're gonna see in the bow-legged or knock knee. Okay, bow leg looks like this. Okay, the leg is kind of bow out. As mean the leg itself cannot support the weight, so therefore it kind of bowing out uh, to kind of be able to support the weight better. Okay, and the knock knee is the picture in the top here. So instead of bowing it out, the leg actually comes in to support the weight of the body, kind of putting the pressure, kind of center point of gravity will be right here in the middle to kind of supporting that weight. Okay, so bow leg or knock knee. Remember that for your test. And you could do the vitamin D test to confirm the diagnosis. Osteomalacia is pretty much same thing, but it's in the adult form. Okay, so growing up just fine, but then in adult you don't get enough vitamin D somehow, not enough sunlight. You have developed celiac disease, kidney or liver diseases, medication that could actually absorb vitamin D or calcium, or sudden gastric surgery can actually do that as well. So, and these one you're gonna have more muscle and the bone pain, and you could have fracture as well. Your bone become more brittle. So this is an old picture of osteomalacia. So your bone become really pliable, really flexible. This is extreme cases, like really extreme cases. You can see the picture probably way back in early 1900s. Um, so really, we don't have that kind of issue anymore. So uh, we don't have that anything that extreme anymore. So the bone can become fracture or weakness as well. You could have bone pain. Uh, Supplement treatment would be like vitamin D, calcium, or phosphorus to help strengthen your bone. You could see that here in Arizona, we are in the yellow stage, meaning that we are can be at risk of having osteomalacia because people don't get enough vitamin D from the sun. Another lovely disease. This one is called the osteogenesis imperfecta. Okay, osteogenesis imperfecta. So this is called the brittle bone disease. This is something you're born with. Okay, you're born with this congenital, meaning that you get it. It runs wild and crazy in your family. So basically, you have this. Means someone else in your family must have had this as well. Okay. Couple of things. One is that your bone become like this is called the bubble boy. Basically, is you because your bone actually become easily fractured by just running into a table or just bumping into people. You could actually fracture your bone. You may have hearing loss because you have three bones in your ear that actually conduct sound in each side. If those bones actually broken, you won't be able to hear as much. You also have a blue tint in the sclera, so the white part of the eye, as you can see, this lovely lady have a blue tint in the white part of the eye. Okay, um, so these are the sign of osteogenesis imperfecta. So again, it runs in the family, and you can see these are little kids who have OI. Okay, so they are shorter in stature because their bone cannot grow normally, and their bone are very fragile in terms of easily break all the time. Another lovely disease is called the osteomyelitis. This is an inflammation or infections of the bone. Myo is your bone marrow, and osteo is your bone. Don't mix this up with the word myo. Myo is with the O. It mean muscle. Myo, M Y MYEL. The EL is mean the bone marrow. Okay, so this is the bacterial infections of your bone. Okay, of your bone. So it actually go deep inside your bone, actually in your bone marrow. Okay, usually it's in diaphysis in your long bone, and usually it cause because of bone surgery. You have some type of surgery, and you actually get infection after your surgeries. Okay, you could have people who are diabetic can actually get this. People who have hemodialysis could actually get this as well. People who have blood transfusions. You have bone pain usually happen on the leg a lot. Okay, leg, feet. You could see the infection is actually inside the bone, and you could see it spread all over the legs. It become red. Okay, um, we could do blood culture. Okay, biopsy, bone scan. Usually, we the way we treat this is using antibiotics to actually treat it for 4 to 6 weeks, and then we could do surgery as well. Next one is called the giant cell tumor of bone. This is where you have a bone tumor, okay, at the end of your epiphysis. Okay, again, this is right on the epiphysis at the end of your long bone. Okay, very rare. Okay, 45% of bone tumors, so it's not that common, but usually happen quite a bit in kids. Okay, it can metastasize to the lungs, only 5%. More in female, limited range of motion. That means if you have this, you cannot move your legs to or your arms to all over the place. You actually are very limited in terms of your movements. You have swelling on your muscle, aches in your arms and leg. Okay, usually there's no symptom at all in early stages. No one knows that you have it until you start having pain. When you do having pain, this is where it's already get to stage 3 and 4. Okay. Testing, we use X-ray, we use biopsy to see it, and surgery, we would cut those off, shave those off, or scrape those off as well. Last one, this is called the fibrodysplasia ossificans progressiva. Okay, fibrodysplasia ossificans progressiva. This is basically a disease that turn your cartilage into your bone. Okay, you actually turning your cartilage into the bone. Again, this is a genetic disease that you were kind of born with, but the condition actually become more pronounced when you become an adult. As you can see, your bones start to fuse to one another. Okay, so these folks, the bones start to fuse everywhere. It keeps growing out of places, and then just kind of fuse your body and contort your body into different shapes and different forms. When you could see right here where the bones start to form along your trapezius muscle, um, and your scapula, you have bone form everywhere. When the bone form to that extent, um, you won't be able to turn your body, you won't be able to turn your head, because now your range of motion become limited. Like when your bone form here, you cannot bend your head backward any longer because of the bone actually formed there. Kind of prevent you from putting your head backward. Okay, so that's pretty much it for this chapter. Okay, thank you for watching, and if you have any question, please let me know. Uh, thank you for watching. Have a wonderful day. Take care.